I'm Rob Froman. I spent a lot of the last year here in the B wing of Mercy Children's Hospital where I was being treated for osteosarcoma. This is room 625 on the 6th floor of the Peds wing of Mercy Children's Hospital. And this is the kind of room I've stayed in for like the last year. They help bring in movies for children. You know, there aren't very many channels for children's shows, but this is a movie list of probably over 500 movies that children can watch. There's a lot of the great children's classics. They even get in some movies that are for older people, so parents can stay entertained while their child's in surgery or whatever. When you see how the staff interact, how the nurses, how the doctors, how all the staff interact, the great care and compassion that they carry out their jobs with, you really begin to see the full picture of Mercy Children's. It's not contained in a room, it's in the people, it's in the services they provide, and that's what helped me survive, and I know it's helped a lot of other people survive. This is the Children's Playroom of Children's Miracle Network. This is something they help fund, and it's a great place for kids and even for young adults. See, we've got like Xbox 360, PlayStation 3. Get your gaming in. You got books for little children. One of my favorites, The Hunchback of Notre Dame. And then there's also toys. Play with toys, got your construction stuff here. Or you could be on the computer like my friend Jonah here.
Hi, I'm Samantha Beamer, and this is the Pediatric Intensive Care Unit of Mercy Children's Hospital, where I spent 4 weeks of my life, one day of which was my 16th birthday. And this is a room that I was in. It might not look like much, but honestly, it doesn't matter what the room is like. It's the people that are here. One day, we decided to have a nail party, and all of the nurses and I painted our nails, and we just had a great time. We watched Jersey Shore every Thursday night, and it might not look like much, but I promise you it's the best hospital. Even though you're here for however long you're here for, in my case it was 4 weeks, but honestly it's just the people that are here. And you make some great relationships, and they treat me like I'm their daughter, and they're not just patients, they're actually family. This is the Pediatric Emergency Department of Mercy Children's Hospital, where I was taken after a car accident left me fighting for my life. And I don't remember being in this room at all, but I have met so many doctors and nurses that have worked so hard to save my life, and I am eternally grateful to them and to this room. Because of your donations, they have this room, and they wouldn't have all of the balloons and the drawings and the paintings that they have in here that make it so good. I was life-flighted to Mercy Children's Hospital about 18 months ago after a car accident left me fighting for my life. I don't remember riding in a helicopter, but I think it'd be pretty sweet if I did. I was told that I was basically saved in a helicopter, which I'm sure I was. The EMTs at the site told me that I wouldn't survive the ride to the hospital, but I did, and I was taken great care of in here and at Mercy Children's Hospital.
This is our Shaw Transition Room, and Dr. Shaw was one of our neonatologists that passed away several years ago, and we use this room for our parents who need to be rooming in with their babies or for grieving families. It gives them some privacy and some time to be alone. So this is our isolette, and the isolette holds the babies that are premature and even some of our bigger babies. This whole top pops up, works as a radiant warmer. We can add humidity into the isolette so that the baby's skin stays moist. The premature skin is very fragile. Then they transition from this to a regular crib. We have 2 breast pump rooms that our moms go into for getting milk for their babies. Breast milk is the best, and we do encourage all of our moms to pump or provide breast milk for their infants. We have 2 private rooms that the babies can go into if they have a problem with their immune system, or if they need private room for any type of infection reasons. And we do have 2 of those. We have our quiet signs. They are a sign that goes on when the the noise level reaches above 80 decibels. It's to remind everybody that we are trying to keep the unit quiet for our babies so that they can grow and have quiet time. Our unit is set up in pods and the twin walls. This is one of our twin walls that can house twins, also separate babies. We have dividers that can go in between the beds. Or sometimes if we have triplets, we will put triplets here also on a portable monitor. These are a set of twins that were born at about 32 weeks, and right now they are still in their isolette and they are under phototherapy. The phototherapy is used for jaundice or high bilirubin levels, and it helps those bilirubin levels come down and helps resolve the jaundice. We do have a little library for our babies and parents so that they can read to their children and hear their voice. It's good for moms and dads both to have interaction with their babies, so that they can be comfortable with taking care of them and they just get to know each other here. This is one of our pod areas, so we have 4 beds that are kind of set up in a square. We do encourage our families to bring in some items from home, pictures of their other children, pictures of themselves, stuffed animals. Brooklyn's done a great job decorating her house here. This is Brooklyn. She was born at 27 weeks and she is now 30, how many weeks? 34 weeks. Yeah, and she was 1 pound 12 ounce when she was born. So she has grown quite nicely.